Welcome to the gastroenterology rotation at Citrus Memorial Hospital. To the second year residents we have with us, we're excited to have you. We hope you learn gastroenterology, see how exciting a field it is. I made this video as a means of formalizing on how to do medical presentation after you've seen a gastroenterology consult before you and I go see the patient together. I don't have a teleprompter, so I'll be looking at my notes periodically. The main thing that I'd like to impart is you have to tell me a story of why you and I are seeing the patient together, what your impression and plans are, and how we can best take care of the patient. So I'll run through a typical scenario of a GI bleed patient. I'd always start off with the chief complaint, the history of present illness, their past medical history, their past surgical history, their allergies, their medications, review of systems, pertinent, positives, past social history and family history pertinent to gastroenterology, physical examination, pertinent labs, pertinent radiographic studies, and finally, the most important thing, your impression, which should be summarized within 2 to 3 lines, and your plans on how you take care of the patient. So we'll run through a typical scenario. We're asked to see a patient with a GI bleed. So I'll play the role of the resident. I've gone in, I've seen the patient. Now it's my time to present the patient to my attending. So this is Mrs. Smith is a 77-year-old lady we were asked to see for a GI bleed. That's the chief complaint. The history of present illness. This is a 77-year-old lady who started having black stool about 2 days ago. She's been taking aspirin and started to feel weak and dizzy for about a week, but started having black bowel movements 2 days ago, and she called her daughter and who brought her to the emergency room. She denies any abdominal pain. She has no prior history of ulcer disease. She has not had any aneurysm repair. She, however, does admit to taking regular aspirin because she's been getting some headaches as of late. That would be the history of present illness. Past medical history, she has no history of heart disease, lung disease, or kidney disease, period. She was told she had a thyroid problem and she takes medication for that. Past surgical history, she's had a hysterectomy and an appendectomy. Allergies, she claims allergy to penicillin. Medications at home, other than the aforementioned aspirin, she's also been taking metoprolol for high blood pressure and a thyroid supplement. Upon questioning her further, she said she's been taking some Advil for her headaches also in addition to the aspirin. Social history is not pertinent. She denies any significant tobacco use, period. Family history is no history of ulcer disease. Her mother had colon cancer and she herself had a colonoscopy 5 years ago, which apparently showed diverticulosis. Physical examination, patient's vital signs, blood pressure was 120/80, pulse was 74. She was orthostatic when we changed her position. She's afebrile. Neck exam does not show any gross lymphadenopathy. She's not obviously jaundiced. Chest exam, cleared auscultation, regular rate and rhythm with some skip beats. The abdomen is soft and benign. No evidence of a hernia, no evidence of an aneurysm. She was having black stool in the diaper when I saw her, so it's obviously heme positive. Neurologic exam, there's no evidence of asterixis. Oh, by the way, I forgot to mention she has no history of significant alcohol use or prior liver disease. Looking at her labs, the pertinent labs are a hemoglobin of 8.2, MCVs 85. White cell count's normal, INR's normal, liver function test normal except for an alkaline phosphatase of 154. CT scan of abdomen and pelvis was done in the emergency room, which showed some diverticulosis, but no the acute pathology. My impression is this is a 77-year-old lady with an upper GI bleed, as exhibited by melena, probably ulcer disease secondary to non-steroidals. I do not suspect a lower GI bleed. My plan at this time would be to start her on IV fluids, check her hemoglobin serially, put her on a proton pump inhibitor drip, and do an upper endoscopy. That would be my presentation. Because this is a gastroenterology rotation, we're more specifically focusing on gastroenterology. As you may have noticed, I didn't talk about a EKG, I didn't talk about pulmonary function tests, because that was not a major part of her history. I hope this has been helpful. I'd love your comments on how we can do to improve our gastroenterology rotation when you go with us. Thank you.